Yes, hello everybody. My name is Dr. Syed Aziz Shah, and I work in the Research Center for Intelligent Healthcare in Coventry University, UK for past 5.5 years. I'm a postgraduate lead there in Coventry University, as well as a cluster lead for healthcare sensing technology. My main work is exploiting ubiquitous mobile signals such as Wi-Fi, radar, or software-defined radio signals in tandem with AI algorithms so that we can monitor different healthcare applications, such as people residing in residential care home or at homes alone, or even like intricate biomechanical movements such as cardiac activity monitoring, respiratory monitoring, and then heart sound as well. I was speaking to Professor Omar Rana yesterday. I mean, I don't use radar that much because whenever I use the red flag is raised. Instead of radar, I tell people we exploit ubiquitous mobile signals which are available everywhere. Yeah, that's a quick introduction about myself. Thank you.
Dr. Syed, your research integrates sensing and analytics in healthcare. How can the radio frequency sensing reshape the secure healthcare monitoring while maintaining privacy and reliability?
This is a really interesting question. Before answering to your question, can I ask a question from the audience? Is anyone here like who doesn't use mobile phone here? At home, not in this hall generally. I don't think so. So the work we do specifically in healthcare, I mean, answering to your question with regards to privacy preservation, I mean, previously, specifically using the idea of using RF sensing in homes, in residential care homes, or even in hospitals as well, so that like we do not rely on acquiring images, video, or audio from the patient, and so that we can monitor them, say, using mobile signals, because all of us use mobile phone these days. All we do, because each body movement, it induces a unique change on the radio frequency signals. So what we do using AI algorithms, we analyze these signals and then infer those changes to a specific body movement, how long the person has slept in a room, or as the person falling down, specifically in elderly like West, where we live, because people, they reside alone at home or residential care homes. So these radio frequency signals are mobile signals. It doesn't rely on visuals, it doesn't rely on audio, it doesn't rely on video as well. All we need to do, we just need to analyze the patterns and then infer it. So intrinsically exploiting radio frequency signals, it preserves one's privacy. So yeah, I mean, so it automatically adds the cybersecurity concerns, addresses, yeah.
Thank you so much. I would like to ask you, I'm interested about the healthcare security because it is very sensitive information, and always we hear about a sad story about it. So what the lesson can a cybersecurity educator draw from the healthcare field about the balancing between the innovation with the ethics?
Yeah, ethics, first we do there in UK, because I mean, they're quite strict on ethics. So what we do, even so the experiment that we are doing exploiting the Wi-Fi signals, software-defined radio signals, or even mobile signals. So when we acquire data, so the first thing we do, we take the ethical approval, so that before the collecting data, and even if we have participants, and the first thing that we go for the healthy participants, so that we don't recruit people who have any underlying disease or going through underlying physical or mental health issues. So this is the primary thing that we look for. Another thing is, even when we collect data in the Excel sheet or something, what we do not reveal their name. I mean, we just keep all the information anonymous, so that no one recognizes like which person's data is collected. So like the privacy should be preserved like from start to finish. Like you mentioned, yes, I mean the work that we do specifically in healthcare domain, it automatically like preserve privacy. But even when we collect data, we need to be mindful so that we do not reveal anybody like sensitive information. Yeah.
Thank you so much. Dr. Thank you for your insightful. Dr. Syed, again to the ethics, and as you are dealing with more about the medical data and healthcare, how do you ensure the privacy and the consent in contactless sensing technology? How we can make sure? Do you have in UK some specific policy you are going through, or is that policy can be adapted in any generalized, I mean, in any other countries?
Yeah, with regards to privacy, right? So like I mentioned, I mean, even undertaking any project before the start of the project, the first thing we do is to apply for ethical approval. So what we put all the details, okay, like this is the project that we are going to do, that's the start point, that's the end point of the project. And in parallel to that, I mean, we explicitly mentioned these are the participants that we need to recruit. And then, like I mentioned before, we are not supposed to reveal the sensitive information with regards to, like, if they're going to any underlying disease or something. So this is something, I mean, even undertaking, applying for the project, sometimes give details about the ethics. Okay, like if we are going to recruit humans, we are going to recruit animals, or if we are dealing with some human tissues or something. So these are quite sensitive topics. I mean, in UK, the challenge is, yes, one of the challenges is developing the technology, but in parallel, I mean, with technology, getting ethical approval, it's an exhausting process there. I mean, not saying you should, like, there has to be balance. I mean, you should implement the same rules there, because I mean, the bureaucratic and clerical procedure is quite so slow there. So there has to be balance. So you can also apply, like, ethical approval before, like, the project starts there, get ethical approval, but not to the extent where it slows down everything in UK. Yeah. So this is where, I mean, it can be implemented.
But sometimes this ethical takes ages, and you have a start date for your project. So what do you do in this stage?
I mean, what we do there, I mean, sometimes we rely on, so there are two ways to do it. I mean, when you're collecting data at your own institution, you need to wait for ethical approval. But in parallel, if your project partners, say like somewhere in Middle East or in Pakistan or in China, so their ethical approvals are quite. So if you have partners there in the project, I'm not saying if they're not there, so you shouldn't rely on them. But if they're partners there, ethical approval there is quite quick there. So this can be one of the efficient. And then ask them to collect data for you. And then, but still in UK, you need to, for public available data, we need ethical approval, but that's quite, like, it's fast in comparison with the ones that you collect data by yourself. So this is one of the loopholes, I mean, one can exploit. Yeah, don't quote me on this in UK that we do.
This is something we believe at KCST. We always try our students to be involved. Even with this conference, we involve and invite our students to do, even they are undergrad, they know about the research, they know some of the students to write a paper, they know what is a new innovation. So this is something we believe here at KCST. A question for you, Doctor, regarding you are leading a large interdisciplinary research team from different disciplines, especially from the medical. What makes a successful cross-domain collaboration that delivers both academic excellence and the practical outcomes?
Yeah, so what we do in Research Center for Intelligent Healthcare, so I mean, although, I mean, the name is Intelligent Healthcare, but we have people from, so we have AI experts, and then, so I'm from engineering background, we have computer scientists there, so there's a closed loop there. And then we have people from clinical background as in hospitals. So they're professors, I mean, they part-time, they work in our center, and part-time there is in a hospital, they call it University of, USCW, University Coventry, Warwickshire Hospital there. I'm sure you have been there, right? You don't want to be there, but you might have been there. So there are people there, like people coming from multiple backgrounds. So when they come together, so like they have different aspects and different angles, ideas, and then when we agree on one idea, say a project or something, so then this is where, I mean, people coming from different background. And then, so in my team, because I lead a healthcare science and technology team, so we have people from different backgrounds, and then from international backgrounds as well. So this is where each of us, like, we bring our own expertise and our experiences, and then when we come together, I mean, multiple minds are better than one mind. So this is where, I mean, yeah, the success kicks in.
Thank you so much.
Yeah,
and I think all of us, we have that.
About it, because I can, yeah, I know about how to make micro-learning work. But I'd like to thank the panelists for a really thought-provoking panel, and including the audience. We've had some fun. And could I invite the President to give some recognition to those who have not received it previously?